I think a big problem, Ron, is the disconnect between the medical community and the dental community. Because sleep apnea is what? It's a medical condition. But where does it occur? In the dental side of the house. So you've got medical guys trying to treat a dental condition. Two plus two
Right,
equals five in that world, right? It doesn't make sense.
right, right. How in the hell did dentistry end up breaking off from medicine anyway? Why isn't dentistry just one of the specialties you can do as a physician? And
Oh,
I think it's because dentists, their bread and butter is drilling and filling caries, and yet that somehow boxed dentists into this, you know, the whole mouth and everything associated with it has been assigned to dentistry, but dentists primarily are trained to drill out cavities.
yeah.
And so everything else that's related to the mouth, such as TMJ disorders and sleep apnea, is totally neglected. And dentists are only doctors aren't learning about it because it's in the mouth and there's no medical specialty that has to do with the mouth. That's dentistry. But then dentists are only learning how to drill and fill, and they're only able to become experts in TMJ issues and airway issues by taking continued education classes, right?
I have no idea. I don't have an answer for you on that one. But it is the biggest issue that I come across, even with our ApnoMed providers, right? When they get started, they feel discouraged because they think that it's not their job. It's not their specialty. They're not smart enough. They need to leave it to the physicians. And my opinion is that it's the complete opposite, right? Who should be doing the diagnosis of an airway discrepancy? It's a dentist. Who do I see twice a year on a regular basis? It's my dentist. They look in my mouth the most. I've My physician that I see once every 2 years now. You look good. That's literally, he puts that thing in your mouth, goes, you go, yeah, you look good. Little
Yeah.
do they know that constricted arch with the tongue patterning and, uh, pulled out teeth, four bite extraction, that patient is probably a ticking time bomb and they literally have no clue. They don't understand that space. So I don't know how to answer that question that you asked. It's a really good question. I don't know where the disconnect happened, but it's kind of like an elitist thing. I think the physicians and surgeons, they think they're the hot shit. But really, it's the dentists who are the quarterbacks. That's what my dad preaches. The dentist, not even the ortho, the dentist should be the quarterback who is strategizing the entire treatment approach because dentists see more people than anybody, than an ortho, than an ENT, whatever it is, because people need teeth cleanings, they get cavities, they're going to go see their dentist. That dentist should be screening 20 minutes in a chair side, not even, that's exaggeration, 10 minutes. They can go through a sleep questionnaire, do an oral cavity examination, and based off of how the patient is looks or has chief complaints, that dentist should be able to say, hey, Ron, I think that you are at risk for having obstructive sleep apnea. I'm going to send you to the sleep doctor for a sleep test, right? Once that sleep test comes back positive, that dentist is then going to decide, I need you to go see this ortho, who is then going to do some expansion or treat your constricted oral cavity. That ortho is probably going to use the oral surgeon to install TADs, to do surgery, whatever needs to be done. So it's a team approach. There's too many freaking egotistic doctors out there who cannot just step away from their high horse and admit that they can't do it all themselves, right?
Yeah.
It's not,
Yeah.
it's Rome wasn't built in one day by one person. It was a team effort. And that's kind
Mhm.
of what my dad preaches and what Dr. Simmons preaches, what all of these doctors who are on the top of their game, they understand that they need the good dentist who needs the good ortho, who needs uh, the good oral surgeon, even naturopaths, dude. I can't tell you how many cases my dad works with a naturopathic doctor because they're willing to step out of the box and do stuff that the physician doesn't want to test for, like a gluten intolerance or a dairy or an egg sensitivity. Like that's real shit, man, that people just goes over their head, you know?
Yeah. Yeah, the problem really does come back to a failure in our healthcare system.
100%.
The
It does.
medical school curriculums are ass backwards. I
Yeah.
don't know. I don't know what they're teaching, but it doesn't they're not teaching about the big elephants in the room that are plaguing Americans and Westerners.
I
They're
totally
just not. And
I
I don't it's not that complicated. Like we're not talking about um uh genetics and cancer genes and invisible stuff that you can't see without a microscope. We're talking about the volume of a box in someone's face.
yeah. I this is all can of worms, my friend, but I like opening these and diving into them, but
Yeah.
it's
Yeah.
almost sounds like a conspiracy theory
Yeah.
because you look at the pharmaceutical industry, they thrive on sick people, right? If sick people stop, pharmaceuticals, which is a multi-trillion dollar industry, is down the drain. Okay. So you look at cancer, you look at heart disease, diabetes, you look at now sleep apnea. Okay. Patients who have sleep apnea, they're at exponential skyrocket, likelihood to have these medical conditions.
Yeah.
Well, why would then these political, people who are involved in pharmaceuticals want sleep apnea to become a more relevant topic? Because if they get rid of those easily, like you're saying, it's not a rocket science. Stop pulling teeth, promote, forward jaw growth, better tongue posture, early things you can do to encourage kids to grow into a proper arch and mandible development. These are very easy things, but then you have less sick people, which means less money being made on the medical side of the house, less pills, less Adderalls. You've got ADD. Everybody's got a. Let's just put everybody on amphetamines. Makes
Mm-hmm.
money. So it's
Mm-hmm.
it's sickening. And I don't know if or when it will change. I don't know if it's my lifetime or whose lifetime, but when you start to really look at the bigger picture, it kind of makes your stomach churn because it's
Mm-hmm.
sickening.